Hi, everyone. Welcome back to another episode of the AVAHO Carecast, brought to you by AVAHO Voices. I'm your host and AVAHO president, Nick Berwick, joined by my co-host and AVAHO executive director, Julie Lawson.
Hello.
Today, we are joined by Chief of Nutrition and Food Services at the Wilmington, Delaware VA and co-chair of the AVAHO Education Committee, Taylor Scialo.
Hi, everyone. Thank you for having me.
Taylor, why don't we start with just telling us a little bit more about your current roles and responsibilities?
So, I currently serve as the Chief of Nutrition and Food Services at the Wilmington, Delaware VA, where I oversee clinical operations and food service operations there. And when I'm lucky in my spare time, I get to jump in to see some patients on the acute care wards or in the oncology infusion suite to help me keep up with the patient care that I really love. I also have the pleasure to be the co-chair of AVAHO's Education Committee alongside Courtney LaPlante. And our education committee for AVAHO oversees and assists in producing quality educational opportunities for our AVAHO members, including some of the ongoing CE eligible opportunities that we have. And our committee also oversees the pre-conference education sessions, which are typically small education events that are hosted the day before the annual meeting on a specific topic of interest to the membership.
Thank you, Taylor. That's interesting. It sounds like you wear a lot of hats. You said like both on your day-to-day job, but also with AVAHO. And I know you've been very involved over the years. I was going to go back to what you were talking about working on the oncology units. And I was wondering, how did you become interested initially to become a registered dietitian focused on oncology patients?
So I'll take it back to when I became interested to become a registered dietitian, and that was in an home economics course in my high school, which I don't know if they even offer anymore, but I really became connected to food and the science behind food and the fact that food connects everyone together. And that really sparked my interest to have a career in nutrition and food and ultimately become a registered dietitian. I started my career at the Bronx VA and I joined as a dietetic intern there. A fun fact is that I also lived on site at the Bronx VA for a few years as an intern, which was a really great experience. And after I wrapped up my internship at the Bronx VA, I stayed on as a outpatient general dietitian. So I was seeing packed patients. I was seeing packed, which is primary care. I was also seeing hypertension, diabetes, CKD, so a large variety. And what was interesting is my office was directly next door to the hematology oncology suite, but I never saw any cancer patients. And I remember thinking that it was so odd that I was right next to that clinic and never had a patient come in my office. So I ended up connecting with the physicians and the nurses there and telling them what I could do. So I told them, I'll come into your clinics, I'll see your patients and talk about the weight loss that they're experiencing or talk about the challenges that they're having during their cancer treatment. And I offered to come into their infusion suite and chat with the patients chairside while they're receiving their infusions to become more connected to the cancer patient population. And it almost just organically grew from there until I was a full-time position solely dedicated to the hematology oncology unit as well as our radiation oncology unit. And I did that for several years at the Bronx VA before I transitioned to my current role in management. But I think what really stuck out to me in working with the cancer patient population was the ability to connect through food in a very different aspect. So, not in the typical sense of having dinner with people and connecting through food, but being able to help people through a very vulnerable time of their life in working through the challenges that come with the cancer diagnosis and helping them use food as a way to nourish their bodies and help them be able to work through their treatment and get to the other side of their treatment, or even just use food as comfort during a very challenging time. So I think when I finally found my way to the oncology nutrition space, it really stuck for me as a great way that it connected all the dots of what I love for nutrition.
I think it's really interesting to think about the story of food. You said that, how food connects us all. And to think about not only the story of how food connects us when we come together around a table, have conversation, so much of our culture, and by culture, I mean everyone across the world, is around food and how we use food as a social component. But we forget what it molecularly is doing in our body. And so, what about that piece of it interests you? In other words, you said, what food can do, how we use it. What was really interesting for you when you were coming into this field about how food actually changes or heals or affects how we think and how we perform?
That's a great point. So, as you mentioned, the food is really, and as we were talking about, food is so much culture. But when you get down to the science of it, if you don't have fuel coming in to help you have energy, you really can't do the things that you enjoy. And we know that during cancer treatment, so many of the patients are struggling with increased energy needs and not being able to take in as much energy through food as they would need to. So then we're really stuck with someone who needs more energy but has a more challenging time to get the energy in. And I think that problem solving aspect I really enjoy as part of the oncology care work as well, because we need protein, we need calories, you need micronutrients, and that's kind of for me to worry about as the clinician working with the patient, and less for them to worry about in terms of how many grams of protein they need to be eating with food. And I'm really trying to help teach them to enjoy the food and eat what you can when you're in a situation where eating becomes so much more challenging than it should be for the average person. So the food becomes so much more than just the culture aspect in our day-to-day life during cancer treatment, and becomes so much of, we need you to eat so that we can get you enough energy to get through your treatment.
That's fascinating to me. I've just been learning recently about eating food in certain orders and what that will do to, for example, to your blood sugar, and, or what time of the day you eat something, or the combination of foods. And I think it's a whole world that we as Americans haven't thought about, or maybe didn't even know about scientifically until more recently. So I guess that leads to my next question, which is more of a funny one. How do you get people to eat foods that they need, but they don't like?
Oh gosh. And that's so hard because, we eat with our eyes, we eat with our senses, and we know that during cancer treatment, we have a lot of patients will have baseline nausea where trying to get them to eat something is very challenging. Or they really will get food aversions during their chemotherapy treatment where trying to get them to eat some foods that they previously enjoyed was very challenging. So it really does come back to that problem solving aspect that I was just mentioning. And I think a lot of it is really working with the patient and meeting them where they're at. So if, ideally, if you go through all the research, it would recommend that the patient is eating a very high plant food forward diet with good quality protein and great hydration, lots of fruits and vegetables during active treatment. And that sounds great on paper. But if you try to do that, if any of us have ever had the flu, we know that that's nearly impossible to do this perfect diet. So I think a lot of the work that oncology dietitians do is breaking down that science of nutrition and making it more manageable for where the patient's at. So often I remember in clinic, I'd be talking with patients of, let's just get you to have a milkshake, right? Like we know that chewing can be more cumbersome, but we can get you to drink something a little bit easier. So why don't we make a milkshake, and can you take a handful of spinach and throw it in there so we can give you a little boost of nutrition? And I think some of those small changes are more manageable for people when they're going through a challenging time like a cancer diagnosis, and also a little bit easier when we're trying to make small tweaks that give a nutrient boost or help us align to more of the nutrition that we need without being too overwhelming overall.
I'm a hematologist, oncologist, and nutrition comes up all the time. And going back to what you said earlier about, well, it's comfort, but it's also vulnerability where maybe they don't have control of a lot of things, but nutrition is the one thing they have some choice about. And oftentimes I find that those visits are when they start asking about nutrition, and I can reach out to our dietitian. But I'm kind of curious, sometimes I'm wondering, what is the role of the dietitian there? Where my patient may be asking, do I qualify for nutritional shakes through the VA? VA issued supplements. So I was wondering, what your thoughts are there, what other resources there are within the VA for patients looking for more information.
I think it goes back to what you were saying. So most VAs should have a registered dietitian. They all have registered dietitians, but not all of them are able to be fully dedicated to oncology care. I think the hope is down the road that, we'll get to that in the field, but I know that that can be a challenge. So I would definitely encourage providers to tap into their registered dietitian colleagues to help with doing a nutrition assessment and really identifying how the patient's eating, what their priorities are there any challenges from their treatment that should be taken into account. Like something, for example, with a lot of patients that are on oxaliplatin where they can't have the cold foods. That's something that you wouldn't really think about for most people, but can be really something that I will talk with them quite extensively about how to make that small change happen in their lives. And for various resources within the VA, oral nutrition supplements, and those are things such as Ensure, Boost, things along those lines, are products that often the VA will provide to patients at no charge during active cancer treatment or at a time when they qualify for them. And to be honest, the criteria for that can vary quite dramatically from VA to VA. So it's hard to say, which person would definitely qualify for assistance in that manner. But I think once connected with the dietitian, they can do an assessment and see if the veteran would qualify for an oral nutrition supplement and if that would be something that they would benefit from. I know personally I have a little bit of a love-hate relationship with things like Ensure because if you read the ingredients, it's corn syrup solids, corn oils, very processed ingredients, which is really not aligned with any of the research we have for how we should follow a diet during active cancer treatment. But I think it goes back to what we were just talking about before. If someone's really not able to eat, that might be so much better than having nothing at all. And the Ensure might be something that helps get them through treatment. So back to that thought of an individualized approach to really see if having something like an oral nutrition supplement would be of benefit to that patient at that time in their care is something a dietitian can definitely help with.
Taylor, I'm hearing you excited about a lot of things within the world of nutrition, which I like to see, and thinking about it from a very academic standpoint, breaking it down to the individual patient's needs. I'm wondering, in terms of this academic space, what projects have you taken on, or what areas are you most passionate about in terms of developing research or projects within this cancer population in terms of dietary health?
Sorry to have to say this to you, Nick, as a hematologist, but I really like the radiation oncology cancer space for nutrition. I've done a few projects with the Bronx VA radiation oncology crew that really helped, I think, open a lot of doors for us in terms of how nutrition can collaborate within the multidisciplinary oncology setting. So I really have a strong interest in prostate cancer and radiation therapy and what nutrition can do for patients that are going through active treatment. And that really came about from the radiation oncology team at the Bronx VA when I was there, and they would tell me that many of their patients would have to get off the table, the radiation table that is, during treatment because of a lot of gas or stool that was in the rectum. And it doesn't sound like that would be relevant, but it is, because if there's gas or stool in the rectum, it's moving the prostate out of their treatment field and can lead to a lot of misalignment with the radiation treatment. So at the time, they asked me if I could help with putting the patients on a diet. And I put diet in quotation marks, air quotes, because they thought that maybe I could put them on a diet and help with the stool and bowel irregularities. And what I found is that talking with those patients individually and finding out what in their diet might be leading to a pattern of bowel irregularity or excess gas was a large component. We were able to make some short-term dietary changes with those patients so that their treatment field could be more aligned and therefore their radiation treatment was more accurate. And we did a lean project to really define that work and found that by implementing some nutrition education into the radiation oncology setting for these prostate cancer patients, that we were able to have a 54% reduction in the amount of times that these patients had to get off and on the radiation tables and have the risk of inaccuracies with their cancer treatment. So that was a really eye-opening project for the radiation team and I, of something small that we could do in collaboration together to help improve the care and the lives of these veterans. And for some of those patients, it was simple changes such as not eating several cloves of large garlic before they went to treatment, because this large garlic volume was a little bit more gas producing and causing them some discomfort during treatment, or small changes such as avoiding broccoli or cruciferous vegetables just during their radiation treatment time frame, because we know that those foods are very high nutrient value, but the risk of the gas and bowel irregularities, it was best to remove them during treatment. And that was a really fun project to, as I mentioned before, showcase the collaborative effort between a multidisciplinary cancer team and what it can do for patients.
So I have a question for you that maybe pivots a little bit. You're talking about the projects you're doing in the VA and with your work. Selfishly, I'd love to hear what you do for AVAHO. So if there's something you'd like to highlight, you mentioned being the education committee co-chair, and I know that you've been doing that for a little while, as well as having been a member of the education committee for a bit. And so it's been fun for me to watch you move in your career in terms of coming up with a project idea and taking it to fruition. And I'd just like to hear what you want to see happen next, what you're doing and what you'd like to see happen.
Well, thanks, Julie. I think I was telling someone on a call recently that I'm coming up on 9 or 10 years of being an AVAHO member, which just really blows my mind that I've been part of this great organization for so long. And in that time, I've really had a great opportunity to be a part of many different projects. I know specifically for the Education Committee, we've had some really interesting ones in the past that I was able to join for. One of them being the health literacy series that I helped develop, that was really geared at meeting the unmet need of having more health literacy training to VA providers, and specifically our AVAHO group. And that was a great few-part series that I worked on through the Education Committee. And it really opened my eyes to an area that was somewhat relevant to oncology care, but not directly oncology care. And I really got to see just how important it is to have a wider viewpoint when we're thinking about cancer care, and not having it so narrow focused on the patient and their treatment, and really thinking about the person as a whole and all the aspects that come together for how we care for that veteran. So that was a great series that we did, I think, around 2024 timeframe. And I was mentioning earlier that the AVAHO Education Committee is part of the pre-conference series. So last year, I was very happy to be part of a integrative oncology series that we did for pre-conference, where we combined some VA providers and some non-VA providers to talk about ways that they integrate integrative oncology into their practice. And that was another opportunity where I think it really reminded me how great AVAHO is at getting all of our multidisciplinary members of cancer care together in one room to talk about how we're going to make sure that the care for this veteran is not siloed, because I think most of us in the VA know that we can become super siloed in our specialty areas if we don't branch out. And I think AVAHO is just a great organization that helps VA providers ensure that they're not siloed in the care that they give to the veterans. So the pre-conference series, being able to really look at integrative oncology from a larger lens of all the different disciplines that were there. We had physicians, we had nurses, dietitians, social workers, just everyone coming together to talk about how we could integrate a more whole person centered cancer care for veterans. That was a wonderful opportunity that I'm hopeful we'll have some more opportunities down the road to add to. I think what I would like to see for the AVAHO Education Committee moving forward is really continuing the interdisciplinary and multidisciplinary work that we do. I think that's such a highlight of AVAHO, and especially the Education Committee, where we're looking at building educational opportunities for members, and it's not just registered dietitians in a room talking about how to build education for registered dietitians. It's, the social workers, the physicians, the nurses, the pharmacists that we have that are all together and talking about how we can make sure that this educational offering meets the needs of all of our members together. And I think that's very unique to AVAHO and something that I hope, and I also say that I know, the Education Committee will definitely continue to do because it's such a foundation of the work of AVAHO.
It really is, and it's probably what I am most proud of with AVAHO. There's so many professional development organizations out there that are specific to a particular industry or trade or practice, I should say, and that we're multidisciplinary is unique and really, really special.
I don't think you get that really anywhere else outside of AVAHO.
No?
I agree. And the examples you gave, the health literary series and the integrative oncology, are good examples of how education committee can develop this content where we're thinking in a multidisciplinary way. And I think we do have to be mindful of that because you can probably take any disease entity and think about how it affects different specialties and bring them all together. And we were even looking at when we had this mentorship program that a social worker can be paired up with a physician or dietitian can be paired up with a radiation oncologist using the example used before. And so that's where AVAHO also with pairing mentor mentees, I think can provide a unique opportunity where maybe those people wouldn't ordinarily be in the same world if they were just going to individual society meetings. I'm wondering a little bit more about your experience either with mentorship, either as a mentor or mentee, and what you think how a structured mentor-mentee program like the AMCAP program AVAHO has initiated can benefit AVAHO members.
That's a great point, Nick. I think that's really a highlight of the start of the mentorship work with AVAHO is really having such a diverse group of people come together to be able to have that shared learning experience. I know I stumbled into some mentorship opportunities really when I transitioned from a clinician to a full management role. Because as I mentioned before, at the Bronx, I was really working as a clinician. And now in my role at the Wilmington, Delaware VA, I'm fully management and only a little bit of that patient care side. And I was able to get connected with a formal mentorship program when I had that transition. And I just found it so helpful to have people who have a different perspective and different set of experience than I do, able to give me their insights, their opinions, and even just share their experiences with me as part of a very, I guess I could say, informal learning experience. So I've had such wonderful mentor-mentee opportunities that I think it's fantastic what AVAHO is doing to build a mentor-mentee relationship. And really, I think what I mentioned before, having that shared learning and being able to not be in a classroom or a webinar or that really structured formal setting that I think we just all get so much of nowadays, and just have organic conversations and troubleshooting together. I have this case, I have this patient, I have this situation. How would you handle it? It's just such a valuable tool for learning and not something you can get very easily in the outside world. So I think what we're doing with AVAHO and building this mentorship program will have a lot of really positive, lasting effects for our members.
What do you see for the future of your field? What is it you would either see coming or you would like to see? Let me ask it that way.
That's a great question. I think that genomics will somehow make its way into the nutrition field. I don't know how. I haven't really put too much thought into that quite yet, but I really think that somehow, some way, we'll see something related to genomic sequencing and diet and, what foods may or may not be beneficial to people in some capacity. And I think that would play a huge role in the oncology nutrition space where there's really a hunger for a lot of information with diet and there's not a lot of data always available. I really hope that there continues to be a big push for research in the nutrition and oncology nutrition space specifically. Research in the nutrition world is notoriously challenging to do because no one eats any one food at all. So you really can't test diets very easily. And I think that challenge translates into the conversations we end up having with patients about nutrition and how they should eat during cancer treatment, because it's not very clear cut, and that's hard for providers and for patients alike. So I hope that there's still support from the field down the road to support nutrition research, and specifically research around diet during cancer, that will continue to move the field forward and help ultimately make sure that we're meeting the needs of patients during that very vulnerable time in their life.
What an interesting point that the rest of us don't think about. And that is what you said about it being difficult to conduct the research because of how those foods interact. And of course, everyone eats different foods and everybody has different body chemistry. And that's really interesting.
It's so challenging because how do you and I could have the exact same diets, Julie, and I could react totally differently than you would. And environment plays a role and genetics play a role. And there's just all these competing factors. So trying to study nutrition, no one wants to fund it and no one wants to do it because it's so complex. So, but it's so needed at the same time. So I really hope down the road, that continues to be something that we can focus on as a field of oncology dietitians.
I hope so, because as we're learning more about our diets and the science, at the molecular level of our food and how it's made and how it's processed and what it does in our bodies, I think you're right. I think we will find maybe even niche ways of targeting specific dietary structure to someone with a particular gene set, or in the case of oncology, we're doing it with that particular diagnosis. But as you said, me being however many years older than you, does that make a difference? Does it matter what gender we are, what pre-existing conditions we have? All of those things are fascinating to think about in the spectrum of what food may be doing for our bodies.
Yeah, and to throw Nick's field into the mix, like what happens when you add this chemotherapy agent versus the next? How does that impact how our food is being metabolized and what's going on with our bodies and the trickle-down effect? There's just so many layers to it.
Like I said earlier, every patient asks about it, and it's a very hot topic, or their caregivers ask for it, and trying to reach them even before we see them in our office, right? Primary care, preventative strategies, just the same way we think about screening, getting that nutritional health early. There's been an increased push to get nutrition into medical school curriculums. And so I'm happy to see all this. I'm wondering, when you look around AVAHO, other dietitians who have participated in AVAHO or those who haven't, or just coming into the VA and want to become more involved, what recommendations would you have for them?
I would really encourage anyone who, if they come into the VA as a dietitian and they're remotely touching cancer patients, I always bring up AVAHO and to get connected with AVAHO and to see what information is out there when you have the entire multidisciplinary care team of a cancer patient all in one room. So I always lead with that. And then I usually follow it up with encouraging them to join a committee. And that could really be from my own wonderful experience of being part of the education committee and having wonderful connections and learning so much through this opportunity. But I do think that dietitians have a great position in the healthcare team where we, as a dietitian, I'm communicating with the physicians, I'm communicating with the nurses, I'm talking to social work, I'm talking to the primary care provider. So I'm really in the middle of this care team and also intimately involved and able to see that patient every week if they need it and call them throughout. So I think dietitians are in a great position where they're fully integrated into the team as well as fully immersed in the care of the veteran. And I think that position can really help in our interdisciplinary care team of allowing a lot more collaboration and conversations and understanding to come about that ultimately improves the care that we're delivering to the veteran. So I really think that having more dietitians involved in our committees and continuing to make sure that the care that or the education that we're providing through AVAHO is reaching all of the different disciplines that we support with AVAHO, that really helps ensure that nutrition is thought about in cancer care. And I think dietitians can really join the committees, get involved with AVAHO, take what they learn back to their care teams and implement this education that's improving the care for our veterans, and ultimately be great contributors to our organization of AVAHO.
That's really a nice way to wrap up, Taylor. I really appreciate it. And I like how you came back to veteran care and how nutrition can be a part of that comprehensive high-level care we provide to veteran patients. With that, thank you everyone for joining us on another episode of the AVAHO Carecast. Thank you again, Taylor, for joining us today. For more AVAHO content, make sure to follow us on social media at AVAHO Cares on X, avaho.cares on Instagram, and facebook.com/avaho.org. If you're interested in becoming an AVAHO member, join us on avaho.org. Thank you, everyone.